Hey everybody, it's Jeff Henderson here with Fleet Feet and Front Runner and Marathoners in Training. We're here with yet another episode of Ask the Experts. And today we're here with not the average Joe, Joe Simko. The Joe. He is the physical therapist here at our in-house physical therapy practice, Fit for Life Physical Therapy. And we're going to go over some of the things that many of you might be encountering as you're leading up to the longest runs, gearing up for your half or your full marathon, which unfortunately is the aches and pains that come along with marathoning. So Joe, thanks for being here.
My pleasure.
We've got a handful of questions, but before we get into the questions, in 37 seconds, give us a really quick synopsis of your running background and your history as a physical therapist.
Well, I started running 41 years ago. I ran my first 10K back when I was 11, and I've been running ever since. I've done over 20 marathons in my day, distances varying, other races from 800 meters all the way up to the marathon, and it's been a big part of my life as long as I can remember. I've been a physical therapist for, 30 of those years now, and have been treating runners pretty consistently the last 20 years of that. So I've seen just about every running injury there can be. So been around the block a few times.
And no doubt he is the sole reason that I'm still moving. So that and the Ultra G, which we'll come back to. So our longest runs lie just ahead of us. Whether you're training for a half marathon, full marathon, what's your best piece of advice as we head into those to try to help and stay injury free?
Yeah, the best thing that you can do is just get through those long runs as best as you can. You know, go a little slower if you need to. I think we all have a tendency as the miles progress to really get concerned if we're not running as hard as we think we should. But I really feel the more important thing is time on your feet, getting out there, getting that mileage in, even if that means backing down your pace a little bit. I think sometimes, especially on the shorter runs during the week leading up to those long runs, we have a tendency to want to really push them and really try to work real hard. We've been working so much over the last 10 or 12 weeks that we feel like we should be running faster, but really our legs are getting more tired. We're having to push through all that fatigue, and that's where a lot of times we end up seeing some overuse injuries here. So really back down the pace a bit, respect the temperature of the summertime, and get through those long runs as best as you can.
And no doubt recovery then kind of comes into play with that. You know, backing off the pace. What about days off? Some folks tend to kind of skip the days off.
Days off. You know, it's that fear of losing fitness. I think we have just this guilt if we put a 0 on our schedule sometimes, and you know, really rest is more important than the workout. The workout isn't where you're making gains. It's when your body recovers the next day. That's when the muscle building happens. That's when your endurance gets better. So the job of the run is to kind of break down your body. You need to respect the rest period after that. You know, for some of us, a rest day might just be a 4 or 5 mile easy run. Other people, it might be 2 days of zeros in a row. That's perfectly fine. Consistency over weeks at a time with the training is really the most important factor, and don't be afraid to take off a day if you need to.
If you start to feel the aches and pains creep up, what signs should I be looking for to back off my training, take a day off, see a PT or a physician, or on worst case, shut it down altogether?
Absolutely, yeah. I think the biggest thing is pain that's consistent, consistently in the same place, happens consistently with running, gets worse when you run. If there's a spot that you can push on and it's pretty tender, and it's getting worse while you run, that's probably a sign you need to check in with somebody. We're all going to have pain. Everybody that runs has pain. You should see me get up in the morning and try to walk down the stairs. It's not a pretty sight. So we're going to have muscle soreness. We're going to have aches and pains. That's normal. Those go away as you're running. As you get a mile or two into the run, it should feel pretty good. If you're in the middle of a run and it's getting worse and you're finding yourself having to limp, that's a sign you probably need to talk to someone at Fit for Life, or see your physician, or talk to one of the coaches, and find out if it's best to have it checked out.
So I'm feeling good now. My longest run's ahead. What are some things I can do to help prevent getting to that point? You kind of talked a little bit about this, respecting the pace, and so if I don't want to have to back off and some other things, what else can I do?
Yeah, I think that some of the things, certainly icing after you're done running is a great tool. Some people really like to jump in an ice bath, ice bucket. I've never done that personally. I'm too much of a wimp, but some people really like that. I prefer just a bag of ice on my legs. Calf sleeves are a great way of post-run recovery to help reduce delayed onset muscle soreness. We've got Normatec boots here, which are compression sleeves that are great for recovery. We offer those at a special MIT discount rate. I think it's pretty cheap. So give us a call if you want to try those out. Those have been shown to help improve performance and reduce that delayed onset muscle soreness. We've also got the AlterG available too. And AlterG is an anti-gravity treadmill that we have that it's kind of like running on a cushion of air. You can get in there and get your normal workout in, get your weekday run in with less than 100% of your body weight. And sometimes that decrease in impact forces allows you to kind of feel a little bit better heading into those longer runs on the weekend.
You mentioned the AlterG, and I'm no stranger to the AlterG. I've been dealing with a few aches and pains myself. So you mentioned what it is. How can I incorporate that into my training? Say right now, I mean, most people don't think running on a treadmill on a 80, 90 degree day in the middle of the summer, but how can I incorporate that into my training regardless of the time of year, both to recover from injury or to just help prevent injury as we get into the higher mileage?
It's a great question. You know, the nice thing about the AlterG is that it's like cross training, but you still get the muscle use that you would get with running. You know, cycling is fine, swimming is fine. That's a great way to get your heart rate up, but it doesn't really give you that the same use of your muscles like you might get with running. The AlterG, you know, it's a nice way of still getting your weekday run in, whether that be your speed work day, you know, or just your everyday 5 or 6 mile run, just to kind of get the heart rate in there without the pounding. So, you know, one of the advantages to being on a treadmill in the middle of the summer is you know, it's hot inside the room, but it's still 76 degrees, not 96 degrees. So that is a nice feature too.
Injuries can be exceptionally frustrating late in training. What piece of advice do you give to someone coming in with nagging pain that isn't season ending, but it's certainly a nuisance?
Yeah, I think that you know, the toughest thing is differentiating between what is important pain to respect as an injury and what is pain that is expected with normal everyday training. That's the biggest question we get. So one of the things that we offer here at Fit for Life Physical Therapy is a free injury screen. We offer you the ability to come in, give us a call, stop by, and take a 5-minute quick peek at what might be ailing you. Stop in after your weekday run on a Saturday over at the Polaris office and find out for sure, is it something that you need to be concerned about. 9 times out of 10, it's nothing. It's something you can kind of push through and work through. You know, we see a lot of repetitive stress injuries. We see overuse injuries. We see a lot of injuries that I like to call fear injuries. You know, the fear of seeing the doctor because, you know, you're afraid the doc's going to tell you to stop running. Well, if your doc is telling you that, you're probably going to the wrong doctor. So find, you know, a physician who's a runner themselves to make sure that they point you in the right direction. The fear of missing out's another thing. Everybody's got FOMO. Everyone's on the internet and following their friends, and you know, you might have a scheduled easy run for you, but your friend might be running a 10K, and you think, oh man, that'll be so much fun. I'm going to go do that 10K, and next thing you know, you're seeing me for an overuse injury there. And then, of course, there's the fear of losing fitness. And what we find is that as we get closer to race day, you know, taking a little bit easier, starting that taper maybe a little sooner if you need to. You're not going to lose that much fitness if you take some easy days and take some days off.
Perfect. When it comes time to reassess goals, if unfortunately that comes time, what pointers do you have for folks that need to reassess what their goals might be?
Yeah, I think you know, if you're trying to hit a certain race and your goal is to run a certain time on that race, everybody has those objectives. Sooner or later, something's going to come up, whether it be an injury or weather, or something's going to present itself where you may not be able to get to that ideal goal. The biggest thing to remember is that, hey, you know what, unless it's the Olympic trials, there's going to be another race down the road that you can hit with and achieve those same goals. So don't get too frustrated. Respect your body, respect the symptoms that you're having. Take a look at where you've been, how far you've come. Maybe this isn't the race that you're going to PR at. That's fine. Go out, have a good time, enjoy yourself. you know, it's the journey right now. It's the friends that you've made with MIT. It's the time you've got to spend with everybody out on the trail, doing those hill repeats, doing those hard workouts together. That's really where the fun of running comes in. It's not that PR every time you hit the trail. Nobody gets a PR every time, so respect that. After your race is a great time to sit back and, you know, reassess where you've come and take a look at what kind of times you might be able to achieve in the future. So I usually use that as my point of reflection. Those 3 weeks after a race is a great time to set goals for next season.
Joe, thank you so much. You've got 30 seconds for one last pointer as they head into the longest run and eventually race day.
Oh boy, trust the training. That's my biggest thing. You know, these guys have set up a tremendous program for you. All those weeks that you put in already, that's the base that's going to set you up. It's not what happens today. It's not what happens tomorrow. It's what's happened in the preceding 10 or 12 weeks. That's where all the hard work's come in. So trust it, respect the taper, and make sure you're ready to go on race day.
Awesome. Thank you so much, Joe.
Jeff.
Folks, keep running. The long runs are coming. You know it. Come see this guy. If you got an ache or pain now, don't wait. Have a great rest of your season, and good luck out there, folks.